Ryan MacDonald with Harvard Consulting. Thank you for joining our June stakeholder update call for the CCI. Just a few house cleaning things before I get started. If everyone can hear me, please press 1 on your keypad. Okay. Looks like everyone can hear us. If you get disconnected from the call for any reason today due to technical issues, just dial back in and use the same password that you used to join the call this morning, and you will be connected just as soon as everything is back up and running on our end if something was to fail. If you have questions, we will be taking questions after our presentation here. You would press 1 on your keypad to ask a question. That will alert us that you have a question, and we will take questions as they come in. Of course, you can press 1 during the presentation if you want to raise your hand and let us know you have a question. With that, I will introduce the guests we have today from the Department of Healthcare Services. Today we have Claudia Christ, Deputy Director for Healthcare Delivery Systems. We have Hannah Catch, Assistant Deputy Director for Healthcare Delivery Systems. We have Sarah Brooks, Chief of the Managed Care Operations Division, and we also have Javier Portela, Acting Chief of the Managed Care Operations Division. And with that, I will turn it over to Claudia Christ.
Thank you, Ryan, and good morning. Thanks all of you for joining us today. We'll be covering several topics on this call today. We'll start with a DHCS leadership update, then we'll cover our regular enrollment update, and we'll share information about our CalMedi Connect Provider Summit next week that's coming up in Riverside. And finally, of course, we will have a chance to answer your questions. So starting with the DHCS leadership update, wanted to let you all know that this will be my last time leading this call. As some of you have heard, I've been appointed to serve as Chief Deputy of Policy and Programs at the Department of Public Health, and will be transitioning there in the next week. It has truly been an honor to work with many of you in my role here at DHCS, and I very much appreciate the on-the-ground feedback you've provided to us and to me personally during this time. I look forward to continuing these conversations with many of you in my new role as well. The great news is that Sarah Brooks, who is the Chief of the Quality and Monitoring Division currently, will serve as the new Deputy Director for Healthcare Delivery Systems. And Hannah Catch will continue serving as Assistant Deputy Director. So you have great leadership continuity, no gaps whatsoever, and you have certainly worked with both of those individuals in the past and our team. Sarah has been here has been at DHCS since 2012. She, in her role as Deputy Director, will be responsible for directing the work of the 4 Healthcare Delivery Systems divisions: long-term care, systems of care, managed care operations, and managed care quality and monitoring. Most recently, Sarah was, as I mentioned, the Chief of the Managed Care Quality and Monitoring Division, and prior to joining DHCS, she was also Assistant Policy Director at the California Association of Public Hospitals and Health Systems. At DHCS, Sarah has been instrumental in leading quality and monitoring efforts and improvements that serve as a national example, and I know that in her new role, she'll continue to work with all of you to ensure the millions of low-income Californians served through our state programs receive high quality and coordinated care. Now I'm going to go to the enrollment update. We actually just posted the latest enrollment dashboard today. You can access this on calduals.org, but I'd like to go over some of the highlights with you now. Overall, as of June 1st, we have 122,846 enrollees in the 6 active CCI counties. That is just a tick up from May's dashboard. For Los Angeles, we are up by almost about 1,000 at 55,661. San Diego, we are at 18,260. In Riverside, we're at 14,373. In San Bernardino, we're at 14,301. In San Mateo, we're at 10,030. And in Santa Clara, we're up just about roughly 500 at 10,221. This dashboard also includes some detailed enrollment, opt-out, and disenrollment percentages, and you can find this chart at the end of page 2. overall enrollment rate is 33%, which is 1% lower than last month. As you can see, we've included a further breakdown in disenrollment numbers as we had announced last time, trying to differentiate between truly voluntary disenrollments. Those would be members that are requesting a disenrollment after the enrollment effective date has started, and other types of disenrollments. So in looking at just the voluntary disenrollment number, which would be people that call after they've been enrolled to actively disenroll through our enrollment broker, is at 9%. We're also able to share more detailed breakdown of enrollment data by things like age, ethnicity, and language spoken. So looking at opt-outs by ethnicity, we see currently that Koreans have the highest opt-out rate in San Diego, Riverside, and Santa Clara County. And they have the second highest rate in San Bernardino and San Diego. We also see that the second highest opt-out rate by ethnicity is Chinese in Los Angeles, Riverside, and Santa Clara County. It is the highest rate in San Bernardino and the fourth highest in San Diego. In Los Angeles, the highest opt-out by language spoken are Russian, Korean, and Armenian, with opt-out rates of above 70% for each of those, and 91% for Russian-speaking population. We see that the Korean speakers have one of the three highest opt-out rates in Los Angeles, Riverside, San Bernardino, San Diego, and Santa Clara. And Russian speakers have the three highest rates of opt-outs in Los Angeles, San Diego, and Santa Clara. Finally, when we take a look at a breakdown of opt-outs by age, we don't note a significant difference in the different age category. However, as you look at those charts, you will be able to see that the lowest opt-outs tend to be between 21 and 64 years of age, and then there's a slight and steady increase as people increase in age, 65, over 65, over 75, and over 90 years of age. This information can also be found at calduals.org, and the purpose of looking at this information and getting further drill down is really to help us with informing the department and informing our new and upcoming outreach efforts, education efforts, and looking at any issues that those populations may have. Passive enrollment is now over in San Mateo, Riverside, San Bernardino, San Diego, and Los Angeles. We are excited that voluntary enrollment in Orange County will begin in July. As a reminder, the 90, 60, and 30-day notices are being sent out directly by CalOptima in Orange County. In late May, 2,719 60-day notices were sent out, along with 3,034 90-day notices. Building on lessons learned through our outreach in other CCI counties and in collaboration with stakeholders and CalOptima, we are planning a robust outreach in Orange. 2 state-supported outreach coordinators from our Harvage team have been assigned to Orange County specifically, and CalOptima and state outreach staff are meeting regularly with key stakeholders in Orange to ensure they have the information and resources they need to engage eligible beneficiaries. We're working to ensure that there's a strong line of communication between CalOptima, our outreach coordinators, the local HICAP, and ombuds. The outreach will begin hosting twice-monthly webinars for providers. Also, CalOptima is working to ensure enrollment of beneficiaries in long-term care facilities is as smooth as possible through a strategic facility-by-facility enrollment process. We're hopeful that we'll be able to share a final plan in the coming weeks, which will include a schedule for enrollment and outreach activities. Those are just some of the highlights of our work on the ground in Orange, and we'll continue to keep this group up to date on our outreach and education efforts there. And of course, you can also see those in our weekly outreach updates on calduals.org. I'm going to turn it over to my colleague Hannah Catch, who is going to provide you with some detailed information on the CalMediConnect Provider Summit.
Great, thank you, Claudia. I wanted to just let you know before we open the call up for questions that together with the Center for Healthcare Strategies and the SCAN Foundation and Harvest Consulting, we at DHCS will be hosting an Inland Empire Cal MediConnect Provider Summit. This summit is on Tuesday, June 23rd, and it will be running from 8 to 3:30 in the Riverside Convention Center. And this event is geared at providers who are already participating in the Cal MediConnect program, both actual providers and also those who handle care management and operations for Cal MediConnect beneficiaries. The goal of this summit, similar to a previous summit that we did earlier this year in Los Angeles, is to give providers on the front lines of implementing Cal MediConnect some concrete tools and information that they need in order to fulfill the program's promise. And we look forward to hearing from providers including physicians, medical groups, IPAs, LTSF, and behavioral health providers, managers, and other staff during that summit. We will be featuring discussions that bring together health plans and other providers as well for practical conversations, and we hope to share some best practices in care coordination, home and community-based services integration, communication techniques for communicating effectively with consumers to explain managed care process, and engaging consumers in their own care, and leveraging community resources and community-based assistance for beneficiaries. And in addition, plan provider representatives from the Inland Empire Health Plan and Molina will be available during lunch to answer questions from providers needing plan-specific assurance. So we look forward to meeting with folks and hearing from providers on June 23rd. If you are interested as a provider and would like to register for the summit, you can find that information at calduals.org/summit. So thank you as always for joining today's call. We hope that the information that we share on these calls is valuable to you. As always, we encourage anyone who has questions and particularly any ideas or topic suggestions for future calls to email info@calduals.org. As always, your comments and feedback are very important to us, and we really rely on them as we continue to implement the CCI. Now we'll open it up for questions.
Thank you, everyone. And again, everyone on the call, if you have a question, please press 1 on your keypad, and that will alert us that you have a question, and we will get to questions as, in the order they come in. Our first question will come from Gary Passmore. Gary, your mic is open.
Thanks. Hi, guys. I just wanted to very quickly say thank you to Claudia. And I feel like we have kept the CCI on a path, short though your tenure has been, I have felt like you've done a really great job helping us make this happen. So thank you and good luck, and I'm going to find out your phone number in the Department of Public Health real soon.
I'll send it to you. Thank you so much, Gary. I really appreciate it.
Thank you, Gary. Our next question comes from Carol Hood. Carol, your mic is open. Carol? Okay, it looks like we have lost Carol. So Carol, if you have a question and you get back on the call, please raise your hand again and we'll get to you. Our next question comes from Norma Jean Vescovo. Norma, your mic is open.
Thank you very much. I just wanted to make sure that when you're having training with your staff, that you're including some of the community agencies that provide the services to them in the community. I'm the director of the Independent Living Center of Southern California, and we so much of the time have to educate or help the people know something about the clients that we're serving and what help they need. And so I think it would be a good thing to combine the two. We've done some training for some of the medical staff, and I think, or especially the nurses and the people that are at the front line. And so it's really important that they know how to talk to people and work with them and have an understanding of what the people are going through on the outside.
Thank you so much, Norma Jean. We are absolutely looking forward to hearing from long-term care providers as well at the Riverside Summit. So really appreciate that comment, and we'll certainly continue to take that into consideration.
All right, thank you, Norma. That is all the questions we have in the queue as of now. So please, again, if you have questions, press 1 on your keypad, and we will get to questions as they come in. Our next question comes from Denny Chan. Denny, your mic is open.
Hi, guys. Can you hear me?
Yes.
Great. Thank you so much for taking my question. I have a couple of questions. I'm hoping they're relatively short. The first is, with respect to the breakdown on ethnicity, I'm wondering if you can clarify when the identity category is listed as Asian or Pacific Islander, who exactly that includes, because other Asian ethnicities are separately listed. So that's my first question. My second question is if DHCS plans on releasing a more complete breakdown past the top 5 categories, and at what point we can expect that. And then my third question is really more of a comment, but I think for a future call it'd be great to hear from DHCS and the plans how the implementation of CPO services is going.
Hi, thank you so much for those excellent questions. So first of all, I think you've noted correctly that there are a couple of Asian communities that are broken down specifically, and then others would and these are how people self-identify. So self-identifying as Asian or Pacific Islander, we will look into seeing whether there is a specific definition that is outlined as people self-identify, and we'll make sure to post that if that is in fact the case. But otherwise, it is definitely just what people self-identify as. So we'll do further research on the actual breakdown of that. And yes. And to your second question, yes, this is definitely a first pass at looking at a breakdown of this. There are many more languages that people have identified with, many more ethnicities, and we definitely wanted to take this as a first pass, and we are at the same time looking at further providing further breakdown information, and also balancing doing that while also kind of keeping it in a concise and easy to read format for all of you. So this was a first pass, and thank you for that comment. We are actively looking at doing further breakdowns in the future.
All right, thank you for those questions, Denny. Those are all the questions we have in our queue again. So please, if you have questions, press 1 on your keypad, and we will get to those as those come in.
Good morning, this is Sarah Brooks, and I just wanted to follow up on the kind of tail end of that question related to CPO or Care Plan Option Services. And I think the question was just, when the department would be providing some information, or if we will be providing information on kind of how those services are being authorized by the health plans. So yes, in response to that question, the department does have intentions to release that data. We currently are still working with CMS in terms of obtaining the full encounter data set for CalMedi Connect, and so once we receive that, then we'll do some analyses and we'll release some data related to CPOs.
This is Claudia Christ. I failed to include something I meant to mention to you on the enrollment data. Remember that we have been talking about the efforts that we are putting in to really make this program work well for people, and make especially those aspects that are particularly crucial, such as the care coordination and individualized approach for folks and resources is done right. And we have definitely been working hard on that, and with a lot of input from stakeholders. We did want to point out that when you look at the dashboard, enrollment dashboard, in the top right-hand corner under July pending enrollment, all of the 2,100 or so, if you take out Santa Clara, all the rest of those are actually opt-ins. So we have just shy of about 700 opt-ins. Those are people that have actively called and make the election to opt into CalMedi Connect. So that, because if you know, those are the counties where we no longer have passive enrollment. So I just wanted to point that out to you as you read that dashboard. That's a number to continue to look for to see how people are doing on the actively opting in, as we mentioned before, transitioning from a passive enrollment to very much of an active enrollment period. And that's certainly something that we'll keep our eye on, because that is in part a gauge for us on how things are going, and we want people to have a very good service.
Thank you, Claudia and Sarah. We have a few more questions that have come in. So our next question comes from Janet Heinrichs-Canterbury. Janet, your mic is open.
Hi, you guys. It's good to be on the call. I'm just curious about the IHSS numbers right now. I'm not actually looking at the website, but I'm curious about whether or not you've seen any uptick in the enrollment or continued opting out, and if you guys at the Sacramento level have any specific plans on what to do about that and how to deal with the IHSS opt-out rate. Being as, I think, you know, I don't know. I just, you know, I have a feeling that for some people who've opted out, it may not be because they don't need the program. It might be because they're scared or they don't want to lose their doctor or whatever. So I'm just curious if there's talk about how to deal with that.
Thank you so much for that question. And before we talk about a little bit about some of the things that we're doing and what we've observed, I wanted to keep the mic on for you for just a second to see if you have any suggestions or any thoughts or ideas.
Well, we've been talking a lot about it with the PASC peers. I work a lot with the consumers, and you know, there seems to be kind of a knee-jerk, okay, I don't want to lose my doctor, but when you get beyond that, I think there are things that are factors, that are important factors. I don't know how to deal with the I'm afraid of losing my doctor, because that one's very, I mean, it is what it is. I don't know how you change that. But just recently we've had some conversations with a couple of the plans, and you know, it turns out that the plans are doing some fairly intensive work with the IHSS program people, you know, with the social workers and whatnot, and trying to develop services for their members who are also IHSS consumers. And I guess the feeling that I had and some of the peers have is that that's a very, that's news to us, that's something that we didn't really realize was happening, and it's fairly important to get that information out. Anyway, so that's one thought, is that there is an IHSS specific strategy in the plans, it sounds like, and that's sort of what I'm asking. Is there an IHSS specific strategy coming from Sacramento that we can have input into and also be aware of as it comes down? I guess that would be my response. Claudia.
Great. Thank you. Three of us are going to tackle your question. It's excellent, and thank you for your thoughts as well.
Yes, this is Hannah Katch. Thank you so much for your really thoughtful comments and questions. I think first and foremost, we would love to work with you. So we'd be very happy to set up a time to sort of discuss your thoughts further and collaborate moving forward. One component that I wanted to just briefly mention before my colleagues talk more specifically about IHSS is that across the board, we are very interested in getting more feedback from beneficiaries, providers, everyone who's participating in CalMedi Connect who can give us more information about how we can strengthen the program. And so a couple of projects that we are embarking on with support from the SCAN Foundation is a couple of different evaluations of the program, both a rapid cycle polling to try to get quick information from beneficiaries about what's working, what's not working, why they signed up, why they chose to opt out or disenroll. We want as much information as quickly as possible from our beneficiaries, including ISSS consumers, to make sure that we have the information we need to strengthen the program or do better outreach or communications if that's needed. And then we have a longer-term evaluation also supported by the SCAN Foundation to look at the program as a whole in a more robust way and do focus groups and other sort of in-depth communications and information gathering from sort of every perspective of the program. So that is one thing that we are doing, not specific to IHSS, but including IHSS. And then I think Claudia had a couple of other comments more specific to IHSS.
Correct. Thank you so much, Hannah. Yes. So before I talk about a couple more IHSS-specific strategies and information, I also wanted to answer the first part of your question, which have we seen a change? And so far, we haven't seen any significant changes up or down one way or the other. It's staying pretty stable from that perspective. So that, of course, is stable, not in a way that we want. We would love for people to opt in. And really, to answer another part of your question, what we've heard from consumers, we have definitely listened. We have gone out and listened, is that a couple of things. One, they opt out because they may be scared. They're scared that what this means to them. They're scared of change. We have heard from our own STED committee members that were able to share with us that, for many of them that need multiple specialists, they have taken a long time to cobble together a kind of a network of multiple providers and specialists that they, have finally kind of dialed in the way that they feel is giving them what they need. And even though it's complex for them to navigate and it's tough and CalMedi Connect, in theory, they feel would help them, they are afraid that if you take one of those little pieces out of that mosaic, that it would crumble. So a lot of it is around education, looking at really the provider piece for them. And so for that, we did hear last time when we heard some of the positive stories, there were several folks included in that were IHSS consumers that experienced had a very positive experience through CalMedi Connect. So it's a matter of also helping to spread the word, but making sure that if there are areas that are of concern, that those are addressed. You've noted that the plans have made an effort to reach out and really focus on IHSS. That is as part of our follow-up as well in our discussions together between the plans and us. And they've really taken this seriously as well. They really have focused on ensuring that the IHSS social worker is part of the interdisciplinary care teams. The part that we are needing to work on is, anecdotally we know that more hours are approved. Anecdotally we know, and we have some data, but we need to really solidify the data so that we can demonstrate that. And then next, also we're working with our colleagues from Harvard on creating a beneficiary toolkit, which is not specific just for IHSS providers, but is really meant to provide helpful information in a way that people can understand and that it means something to them. And that includes IHSS providers as to what CalMedi Connect could or would mean for them and specific to their needs. And then I'm going to turn it to Ryan from Harvard, who's going to talk a little bit about the IHSS provider-specific outreach effort.
All right, thank you, Claudia, and thank you, Hannah, for that. And Janet, first I want to say that we've worked together with you and Greg and PASC in the past on outreach, and we definitely want to continue that relationship and collaboration between Harbage and PASC, and I know you guys do a lot of great things. I think I just got a call from a telephone town hall a night or two ago from you guys. So I know you all continue to do a lot of work, a lot of great work, and we want to continue to work with you. Because of the opt-out rates with IHSS, we've obviously looked at our outreach, and we're building strategies to kind of refocus our attention on you know, what we can do, what was missed in the past, and some new strategies that might work well in the future, and kind of building on what Claudia was mentioning of, you know, all those thoughts and what we're hearing anecdotally why IHSS beneficiaries are opting out at a higher rate. We want to start to try to incorporate some of that information into our outreach materials and into our outreach, first of all, directly to IHSS beneficiaries and their providers, just to try to allay some of those fears and to try to help people understand that the programs can give them some very great benefits and not take away from their IHSS services. So that's kind of our strategic approach. We've been with materials, and we've been working with, we've been reaching out to the unions to work with them on the ground to see if we can amplify their efforts on outreach and see where they can help us, and they can connect us to a lot of caregivers. And that's one of the ways we think that we can be very impactful, is if we can educate the caregivers for the IHSS beneficiaries, knowing that they're trusted sources, and you know, we can get a lot of information to them, hopefully, that will be helpful for the people they provide their care for. So that's some of the things we are doing. We have our dedicated team continuing our work on the ground, and you know, our coordinators, so we will have our coordinators refocusing in Los Angeles. We're also starting out a relationship early on with the Public Authority in Orange County, as well as the unions in Orange County, to make sure that we are working with IHSS beneficiaries and caregivers very early on and giving them the right message in Orange as enrollment starts there. So those are some of the things that we're doing and thinking about. I would love to offline with you. I'll shoot you an email in the day, you know, before the day's over, and we can set up a time to talk some more about your thoughts and Public Authority's thoughts on outreach to IHSS caregivers and beneficiaries. Thank you for that, Janet. Our next question will come from Pauline. Pauline?
Hi. Hi. So my question may be a little bit off topic, but it's in regards to the CMS letter that was issued, I believe, May 7th, extending spousal impoverishment. And part of it was that it described it would apply to the 1115 waiver. And my understanding is that part of that is seniors and persons with disabilities that were mandatorily enrolled in managed care. So I was wondering if you could give me a definition or a list of what home and community-based services are offered under the CCI that this would apply to.
Thanks so much for that question. My understanding of the special impoverishment guidance is as it relates to our eligibility. So we do not have the right people in the room to answer your question specifically, but if you'd like to send it to info@calduals.org, we'd be happy to get you the right information.
Thank you for that, Pauline, and please email us, and we will get that email to the department, to the right folks. With that, we are through our questions in the queue. If anyone that we missed or was not when we called your name, please raise your hand, press 1, and we will get to your question. All right, everyone. That's all the questions we have in the queue today. If you have questions in the future, please email us at info@calduals.org, and we will make sure to get you an answer to your question. Thank you for joining us today to hear a very important update on the Coordinated Care Initiative, and we will talk to you next month. Thank you very much.